Welcome to Cut the COVID Web Part 53. The Danish COVID vaccination policy versus Washington DC. T-shirt of the week, a new one, speaks for itself, I guess. Okay, so I don't know if you know what the Danish COVID vaccination policy is, but um, in Denmark, if you're under 18, you cannot get vaccinated normally, unless you have unless the doctor gives a special permission for you to do so. Um, so you cannot get your first vaccination as a child under 18. As of the 1st of September, you cannot get your second vaccination if you had one before already. So that's the Danish policy. Didn't it wasn't always like that. They had age limit of I believe 12 before, and they upped it in the last month or two to 18 to be effective already partly and even more so as of the 1st of September. So they changed their policy again. If you're under 18, you normally are not allowed to get a COVID vaccination. Take Washington D.C. in the US, and they're at some public schools, I believe, mandate 12 years in order to get vaccinated. So in one country, it's prohibited. In another country, it's mandatory. And now you need to make up your mind what is best. Apparently, even at the national level, different governments, the government bodies don't agree with each other. But you as a person still needs to make a decision on what to do for yourself or possibly more importantly for your kid. Um, Oops, I just have to click something away. That's fine. Okay, so what do you make of that? Now, in the meantime, you um, may have heard a couple of things about misinformation lately. I'll just name a few. The UN, United Nations, says that misinformation rumors have hindered vaccination efforts everywhere. So misinformation have hindered vaccination efforts. But is that a? I can imagine that 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 happens. I can also so it can be that misinformation lead to fewer vaccinations, but it can also be that misinformation has led to more vaccinations than people would have decided if they had not been misled. I mean, the American president saying if you get vaccinated, you don't get COVID, yeah, was maybe a reason for people to get vaccinated. And that clearly wasn't true in the end. So, what is the UN trying to say here? I'm not so sure. World Health Organization. The World Health Organization says that Mythbusters will work closely with companies like Facebook and Twitter and YouTube. And then we got the World Economic Forum saying that they recently published an article saying that their opinion paper calling for global censorship using artificial intelligence and human intelligence. So the World Economic Forum is for global censorship. Um, so somehow this center of for conspiracy theories, I guess, favors global censorship. So now with the with the Danish and the Washington D.C. Um, opposites of their policies. What should you do? What is one government policy the truth, and is the other one misinformation, or is there different misinformation in different countries? I mean, the virus is still the same virus, right? So there's no Danish virus that has to be dealt with differently than a Washington D.C. virus, I think. So what do you have to make of it? And to give another example, in the let me just read this from my phone. So the CDC in the US has quietly changed their COVID guidelines, or actually the facts about mRNA COVID vaccines. Um, so these are facts, literally. Um, so one fact is that they used to state is the mRNA and the spike protein do not last long in the body. Our cells break down mRNA from these vaccines and get rid of it within a few days after vaccination. And scientists estimate that the spike protein, uh, like other proteins your body creates, may stay in the body up to a few weeks. So that was considered a fact about mRNA COVID-19 vaccines on their own website. But in the last couple of days, that paragraph has been deleted. So up to a few days ago, the fact was that mRNA and the spike protein do not last long in the body. And now that's not a fact anymore. So what has changed? Has the has the spike protein changed in the last couple of days? I mean, what is a fact and what is not a fact? Um, is quite is not settled yet. But still, we need a global censorship, apparently. Sounds a bit dangerous to me. I mean, I for myself try to, that's the reason I'm doing these videos, for my own sanity, and maybe it's useful for some people. I try to um, see what the, well, like by purposely looking for different information, different opinions. I try to um, yeah, form an opinion on what I believe, I guess. Like, I'm no specialist in any of these subjects, so I can only form my opinion well by reading details for people arguing for a particular thing, like vaccinations, and people arguing against. And then by looking at those arguments and seeing what makes most sense and how they respond to each other, can try to make up my own mind. Now, the last thing I want to talk about is the masks. Um, I'll put a link in the description below. Um, it's uh, it's from Dead Man Talking. It's a clip about a mask expert. Um, expert shares his abundant knowledge and experience. So this it was taken from some kind of hearing in the US. Um, before continuing with what I have to say about it, please have a look at that link, and it's roughly I believe it's a roughly 10-minute video or something. So link below, have a listen. This guy is basically saying that masks hardly work and they're ineffective, and they shouldn't be used as a policy. Um, Now, when people have these kind of opinions, what I should do as a listener, as trying to make up my own mind, like if it's voluntarily, whether I want to wear a mask or not. I look for biases, like if, for example, somebody argues for masks and he's a mask producer or works for a company that produces masks, then likely he will have a bias um, for masks. If it's a politician that has a particular opinion on masks, for or against, and he may have we will very likely have a bias that just confirms his previous position, because politicians generally don't like to admit that they're wrong. So I'm looking for biases, and yeah, and I'm looking for technical arguments whether things work or not, and if people reply to the technical arguments, then you can sort of see if the technical arguments hold or not. Look at this video. This is a man he's a professional engineer, Stephen Petty. He's certified industrial hygienist, certified safety professional, professional engineer, and he's got 45 years in the field of health and safety, trying to protect the workers from toxins in general. He was named slash testified in over 400 legal cases related to exposure control and personal protective equipments, PPP. So listen to this guy, and then you'll see that he has, with all that background, he sees no reason to wear masks. And again, form your own opinion. I mean, he has technical arguments, and I mean, he has technical arguments, and conclusion is that they can, if they work, they can only work for a little bit, given the size of the particles we're talking about. It makes technically sense that what he says is true. But yeah, if you see something like this, I wonder if you're still for masks based on what that is then. Like, I'm not saying this is a guy you should, this is the expert and he's the only one that you should believe, but like, if you see this, what do you have against it? And are there other experts with technical arguments that, or experts is a sort of like a maybe overused word. Somebody with at least relevant experience, um, who argues for masks, and what arguments does he use? Because like, I find this very valuable. See it for yourself, make your own decisions, and if you make your own decision and people disagree with you, ask why. Like, what do they base their opinion on? Because if it's based on politicians saying stuff, by now we should really be aware that that doesn't hold much, right? I mean, if the president says if you're vaccinated, you won't get COVID, or if they say it's a pandemic of the unvaccinated, clearly not true. So what do you believe, or what makes you change your mind? For me, it's these kind of um, testimonies, or wherever they come from. Feel have fun making up your own mind, and if somebody disagrees with you, try to still respect them. See you next week.